Welcome, dear viewers, to today's episode of Visite. And thank you for all the interesting letters you sent me. And I would like to answer them again in this episode and have the first one in front of me. It is a 56-year-old patient, Martina, who writes the following. It was found that there is an ammonia load, or the kidney seems to have developed a problem. Via the MetaVital scan, that is the Oberon device, an ammonia detoxification is reduced. The result is a slight kidney weakness, of which she actually doesn't notice anything, and the question is actually that she knew that ammonia can also be toxic to the kidneys, and what can she actually do against this increased ammonia level? She also wrote to me, she had another question, that she noticed that the urine would always be so light, and whether this is perhaps a deficiency in bilirubin. You all know bilirubin is the breakdown product of our red blood cells in the liver. And bilirubin is then the dye that actually also turns stool or bile so deeply yellow. And if there is a lack of bilirubin, then the stool is very light, but actually not the urine. But let's get to the answer to that question later. But what is ammonia? So the level of ammonia in the blood can be approximately 60 to 90 micromoles per litre. Ammonia is a cell poison, and ammonia is always produced in our organism when we eat protein. You know proteins, for example, meat, sausage, fish, cheese, yoghurt, curd, cheese and egg. We also have vegetable proteins, that's quinoa, that's lentils, beans. These are vegetable proteins that are also subject to a metabolic pathway in protein digestion and utilizations like animal proteins. Our body needs to draw 70% of its nutritional requirements from a good protein reserve, because the protein is the building block of life. And in the context of this protein utilization, the proteins are broken down into amino acids via the small intestine and via the enzymatic force of proteases and many other enzymes. Amino acids are then the building blocks, and we say we need 8 of these essential ones every day, supplied through the diet so that we can build up the body's own 22 amino acids with the help of the liver. No immune cells can regenerate. No new cells can regenerate. No hormones, no transport of iron, nothing would work if these proteins were not available in sufficient quantities. On the other hand, we say, not so much of these proteins, because if the protein load is too great, Wen speaks of the so-called protein storage diseases. The kidney is then overwhelmed in excretion, and too many side products are created. And that is ammonia, for example. In addition to splitting into amino acids, the protein synthesis then separates via the endogenous structure of the 22 amino acids, and on the other hand, the path is one of energy production. So protein gives energy, and here the end product, or the metabolic side product, is ammonia. For ammonia, it is very important that it actually, when it is produced in the body, is excreted through the large intestine and then the stool. This is actually a process that we succeed in, but it's tied to the fact that for protein digestion, the small intestine, first of all, has a good, slightly higher basic pH. The small intestine is at around 8.5. The large intestine, however, must have a pH value of 5.5 to 6.5, and only if it is from 5.5 to 6.5, then a person can discharge this ammonia. Ammonia stinks like rotten eggs. You will notice this from the smells, but it is important that it comes out. For our protein digestion when we eat meat, for example, we need 4 to 5 hours. These are pretty big processes that our intestines do for us. And do you know who is responsible that the small intestine has a pH of 8.5 and the large intestine of 6.5? Yes, our lactic acid bacteria. In this series of Visite, but also through conversations with Alexander Glogg, we have often talked about right-spinning lactic acid. It is this right-spinning lactic acid that makes the colon so fermented, milk sour, acidified, so that ammonia is excreted. If this ammonia is not excreted, if this pH value triggers itself to be fairly basic, then the cell poison ammonia gets into the blood. And do you know who the one is who has to dispose of ammonia now? I think you guessed it, it's my favourite organ, mother liver. Mother liver can turn it into urea. This urea must then, of course, be excreted by the kidneys. But the liver has a very big responsibility, and of course, only a limited capacity to remove this ammonia. But ammonia itself has a major side effect. It can block important components with the energy metabolism. That said, ammonia is also an intracellular cell poison. And if it is confirmed by this energetic examination that you have an ammonia overload, then of course you have to look on one side first. Doesn't the liver manage this breakdown process well? If the pH of the large intestine is too basic, that the liver is overwhelmed by it? When doing stool exams, I see 80% of the time that the lactic acid flora is simply undervalued, that it is insufficient, that people eat far too little of these fermented vegetables. Far too little apple cider vinegar, far too little perhaps raw sauerkraut, drink far too little sauerkraut as juice. These are questions you should ask yourself now. We need proteins, and with that we always run the risk of ammonia being produced. But the body has a good system in itself to get rid of this ammonia in time. And therefore you have to focus on A, what is my diet like? B, how is my bowel situation? C, what should I do for my liver? Why does the liver have problems and worries when it comes to ammonia exposure? And of course, maybe also look at the kidneys in the context of urea excretion. That would be important, quite typical for people who also have impaired liver function. A disturbed metabolism in the intestine. And the ammonia is now being produced far beyond the limits. And the liver is limited in this ammonia breakdown. Is a condition called encephalopathy. That means a disease develops due to the liver disorder I am no longer within the scope of my anamnestic function. I have muscle twitching, people are so somnolent, their mental activity is clearly blocked. And they have a very noticeable sweet breath. It is therefore very important when the liver, or when people have severe liver disease, that they take great care, that they have good bowel movements every day, so at least once or twice, because if they are blocked and constipated for 2 days, then the ammonia level can go so high that disorders in the central nervous system can occur because of the cerebral, let's say, clinical symptomatology, as I have just explained. That's how we can see it. You are very, very far away from that, Martina, but I would ask you not to worry about this now. But this indirect hint may lead you to a concern or problem within your bowel. And I would just pursue these questions. This can be proven wonderfully in the context of a corresponding stool examination. And maybe you come up with completely different questions that your body doesn't actually present at the moment. That's the beauty of such examinations. When one speaks of prevention, one does not speak of we look and we see nothing with our macroscopic eye, but we just want to understand where the metabolism may be in need at the moment, where we can support it, where we can relieve it. And I don't think you have to worry that much about this problem, but it's very valuable to know things. The urine, when it's light, then it actually has nothing to do with ammonia or bilirubin. That would be the stool. It's good if we humans would also watch our urine from time to time. This is called a urine watch. A normal urine is actually light yellow. So that's not a colour that would somehow worry me as a doctor now. Of course, it becomes more intense in colour, deep yellow, if you drink little. Now, drinking is not something where I say that everyone has to drink 2 to 3 litres. I have a large clientele myself, which I look after, and that's a great reference area. From 1 litre to 2.5 litres. A body can naturally adapt to the daily amount of water available to it. And it will regulate it. Thirst will steer us. But it is important that if the urine is dark, then on the one hand it is really a question, am I drinking too little? But on the other hand, of course, it can also be an indication of inflammation of the bladder and inflammation of the kidneys, which I actually feel clinically. But if it smells very strong, then you all know the feeling when you have a bacterial infection. So this urine, it really stinks. Please be very careful and mindful, because then that means now a cystitis is developing, or you will be clinically aware of it. And cystitis is usually not treated with antibiotics. A cystitis means, first of all, now you should be drinking without end. And I love the combination of marigold, chamomile and nettle. That means stimulating the kidney and regulating the inflammation down first. Everything that is comfortable and warm now helps the bladder. That means warming the bladder and keeping your feet warm. Mannose is a sugar that prevents E. coli bacteria from clinging to the bladder. Cystitis is often caused by cold, because when you get cold, then the bladder gets less blood flow. and that can already cause a higher development of these germs. That is one variant. The other is when we have dysregulation in our acid-base balance, and fixed acid burns, hurts, irritates the bladder wall. In this case, to ensure a good pH value and regulate in an acidic environment with a good base powder. This regulates the inflammation down. If there is blood in the urine, you will see it too, because it is an indication that the bladder wall and everything that is inflamed swells up, that the bladder wall is irritated. So please drink a lot, provide warmth. The blood, which then turns the urine a little dark, or also could drip, must always be taken in relation to an inflammatory reaction. It's a very normal state. Sometimes there is unbelievable pain with bladder infections, and a clinical examination has to show which pathogen is behind it and how to deal with this problem. But there, you can actually do a lot yourself. By the way, people who repeatedly suffer from cystitis should really look at the anterior tooth area, whether the kidney meridian is not blocked, the bladder kidney meridian, or whether you have a big scar in the abdomen, which actually blocks the energetic supply of the bladder. Or also think of our navel. This is the oldest scar that we all have. And scars can also become disruptive fields and thus blockages of regulation. But I think you don't have to suffer from recurring cystitis, and above all, which is completely counterproductive, to answer with antibiosis every time. A very helpful therapy for bladder infections are neutral therapeutic injections. This is done by a specialist of neural therapy, and you should contact them. You can regulate the inflammation down very quickly, even if you have a bladder infection. We ourselves also take complex homeopathic remedies like Cantharis to actually reduce this inflammation and also to improve the structure of the bladder as part of an antibacterial effect. If you have cystitis, please always think of viruses. You can also have that examined to what extent. Herpes virus, skin virus, mucous membrane virus loads are present in this regard. And a lot more. But also have a look at your own urine. That was a small concern of mine. When the urine foams, you always have to think about protein. When the kidney does not excrete enough protein, or when the kidney excretes too much protein, the urine foams. Men often have such a trickle. Men are sometimes under such pressure or cannot get rid of urine right away. This is then a problem that the prostate enlarges. What happens in men as part of a hormonal change? What can happen with an estrogen surge? Or through a parasitic load, but also a toxic inflammatory load on the prostate. And these are things that can also be clarified clinically, and the size of the prostate can be reduced to 30% with saw palmetto extracts. But nothing can replace really recognising the causes of such things. Well, and finally, a sweet urine is, of course, an indication for a sugar. Whenever the sugar level rises in the blood, the kidney opens and lets out the excess sugar. And I think that's some more valuable information. In the moment you asked me, your urine was very light coloured, but that doesn't usually have to mean anything worrying. I think we have a little time left for a second question, and this question comes from a patient who is Serda, and I would like to answer your question. You write that you always have a stubborn inguinal fungus. And this used to temporarily disappear due to antibiotics. And then it came back. When you were on vacation, when you had sun, air, sea, and of course peace and quiet, the fungus was gone. But after a few weeks and you are taking a high combination of nutrients, there are almost 2 or 3 lines in your email telling you what you are taking. From bee pollen to vitamin D and zeolite and B complex and coriander and so on and iodine, the fungus is back. And you'd really like it to go away. A fungus does not just disappear if you want it to, but a fungus will only find itself comfortable and content if it finds the right milieu. And that is with you. That means the view has to be completely different. Nothing is done about the fungus now, but rather one tries to withdraw the medium or the milieu from the fungus. It's the same when you have something in your fridge, or not even in the fridge, when it's outside and gets mouldy. Then you have not been careful enough to give this food what it needs to stay intact. So mold can develop very quickly on a jar if, for example, you haven't closed the jar properly, or if you did not put the liver sausage in the glass in the refrigerator, but rather if it has been outside in the heat for 24 hours. The liver sausage jar is closed, nothing gets to it, but the processes inside develop into a fungus. And that's exactly what happens with us. So this great order in our body to maintain a so-called acid-base balance naturally binds the body to our granting it to it. And if you have a stubborn inguinal fungus, then of course I think first of all, who is she? Is she overweight? Because the groin is warm and the groin is sweaty. And the groin is damp when you're overweight. It's the same when women who have big breasts are always inflamed below them, and the fungus develops with an itch. Simply because the bosom makes an almost hermetic seal here, and that sweats and gets wet. A fungus needs that. So if you were on vacation and it was summer and you wrote there was air and sun, then it was also dry, and a fungus cannot detoxify itself under drought. That is why it's very important, if it is exclusively a local event, that you have that in mind and always make sure that this area stays really dry. Either after showering, that you blow dry properly, that you take powder like a normal baby and powder it, so that the body can absorb the dryness again and again. That would be a local problem. On the other hand, it can, of course, also be that a so-called candida exposure can also be systemic. And if it is systemic, then of course it also has something to do with mucous membranes. This has something to do with bronchi. Then I can get recurrent tonsillitis. Then I can have an itch at the anus. Then I can have joint pain. Then I can have menopausal symptoms. There are also incredibly many symptoms that are triggered by candida. For example, neurological symptoms, headaches, decreased concentration, dizziness, visual disturbances, and also such a light tremor, trembling. Please give this suspected diagnosis an opportunity to clarify whether whether there is a candida load behind it. You can test this with a so-called lymphocyte transformation test on candida. Certain laboratories do that, and you can see how well your immune systems is dealing with a candida exposure. This is important because also sweating, cardiac arrhythmias, sleep disorders, up to mood swings, depression, can be caused by candida loads in us. And everything has causes. What we observe is that people are loaded with toxins. And toxins, heavy metals, form a symbiosis with fungus and candida. So that I don't actually have a superficial concept against mycosis, against fungal contamination. Because heavy metals and fungus have a symbiosis in the sense that they bind heavy metals. So let's treat our fungi a little more lovingly. Because if we remove the fungus now, the heavy metals are free again. Therefore, you should really clarify both things, and also, for the therapy, force a heavy metal discharge. After knowing, of course, how the individual patient's detoxification is, and, on the other hand, of course, regulating the environment for the patient. And it feels good in an over-acidic one, which is why it is always important to have a good base mixture and give sodium bicarbonate as a base, just by a good balance of selenium, a trace element, and zinc, maybe 100 to 150 micrograms, and zinc 15 to 30 milligrams. You can significantly activate detoxification in the liver intracellularly. But you have to change the milieu of the fungus a little. And to change the external environment, that is what we have just discussed. But inside you can, for example, do isopathic therapy. With us, everything always precedes a dark field. We already get the first indication of such burdens. But a milieu renovation, or a milieu in which the fungus can no longer develop at all, would be, for example, the Fortikel. Please take one Fortikel tablet 3 times for 14 days, and then the Pefrakel for a few weeks. These are not antifungal medicines, but isopathic homeopathic remedies, which intervenes the information that the fungi converts back to its normal microorganism. That is the pleomorphism according to Enderlein. And at the same time, with the Pefrakel, 1 tablet a day, I always give the Albicansan. And the Albicansan is increased very slowly, starting with 5 drops twice, until later you reach 3 times with 10 drops. I would start with this therapy, which you can also do if you keep having oral thrush or cradle cap. Well, of course, you have to be careful with very, very small children, very small doses, for whom, for example, an isopathic homeopathic treatment may not seem tangible at all. I just want to say, Dr. Fisher of the London Homeopathic Hospital once said a very nice sentence. When a chemist studies a homeopathic remedy, then they can only actually find alcohol and water. But when they examine a floppy disk, for example, then they can only find the chemical substances that make up this disk. But both have an incredible amount of information. And even if we may not understand a homeopathic treatment, in depth our body reacts to this information. And we have an incredibly good experience, especially for large mycoses, which are responsible for much more than we can even clinically measure today. To always use an isopathic basic treatment as a basis here, and not, for example, with antifungal agents like nystatin. We usually hardly need that at all. I hope that with these remarks, I could help you a little bit further today. I wish you and all of us a wonderful next week, and I'm very much looking forward to next Sunday evening. Goodbye. Dear viewers, the preceding episode is an indicator for her holistic medical approach and does not replace visiting your family doctor. Thank you.